It's a beautiful day. Lucky that we live Hawaii.
24/7, 365.
Swimming in the ocean anytime.
Take a leap.
Well, live healthy. Eat well. Be active. Keep it going every day.
Take a little bike ride. West side.
Aloha kako, and welcome to another edition of Foundations for Healthy Generations, a program for and about public health issues in Hawaii. Each month, the Department of Health explores our programs and public health services in Hawaii, touching on issues that affect us all. On December 10th, our health director, the late Loretta Fuddy, passed away during a fatal plane crash leaving Kalaupapa Settlement. During today's show, we will briefly honor her legacy by talking with her deputy directors who work closely with the director on a daily basis. Today's show cannot fully express the department's deepest admiration and respect for the late Loretta Fuddy, but in this brief and impromptu format, we hope to share a few fond memories and insights. Our show Foundations for Healthy Generations was given its name by Director Fuddy, who appeared on our very first show that aired in August 2012. Past shows may be accessed from the DOH website at health.hawaii.gov. It's my pleasure to welcome today Gary Gill, our Deputy Director of Environmental Health, to the show today. Thank
Aloha.
you. Aloha. Thank you so much. We had a great time the last time that you were here when you were talking about high five recycling. I just want to find out a little bit, I guess, to just recap the year 2013 with environmental health. What were the major happenings?
Well, you know, it's always a busy year, and this year is no exception. Most of what the Environmental Health Administration does is pollution prevention kind of activity. Any discharge into the air or into the water or onto the land requires a pollution control permit, so whether it's a clean water issue or an air issue, ranging from greenhouse gas controls to limitations on discharge from sewage treatment plants or any of those issues, recycling, solid waste issues keep us busy year-round. So, but that's all just 1/3 of the operation. This year's also given us some pretty high-profile events, a huge molasses spill that we had to deal with. Our emergency response program took the lead on that and pulled together other elements of our environmental health team. We had our laboratory, of course, running samples, our clean water branch, water monitors out there in the harbor, taking samples at the surface and at the bottom of the harbor to check for environmental impacts from the molasses spill. Lots of activities this coming year will be reflective of all the work we've done in the past. So we stay busy, and this past year has been no exception, and it's going to be busy again in the coming year with the legislature starting up and all the bills and the resolutions and the issues that will be before us.
Yeah, well, in this past year, what kind of impacts would you say that the director had on the various programs or initiatives within your administration?
Yes, well, you know, Loretta Fuddy, we called her Deliana. It was her spiritual name, and she liked all her friends to call her Deliana, and that means she wanted everybody to call her Deliana, because she was, in fact, a friend. She was a veteran at the Department of Health. She had served for more than 3 decades. She had been in leadership as a deputy director in the past and worked her way up through the programs in family health. She's a social worker by training and just a complete loving and supportive individual. So she knew so much about the department. She knew more about the department than all the deputies put together, just because she'd been there so long and seen so much through different administrations. One thing I really appreciated is, although the environmental health programs are different from most of the health programs in the department, we're not medicine, and we're not behavioral health or psychologists. We're environmental regulation. And although that was sort of a new topic to her, she was instantly familiar with it. She was aware of the details. When a complex question came to her about my part of the health department, For example, in a legislative hearing or a budget conference, she knew the details. She could explain my programs even though she had never been involved in them before. She was a quick study and is a tremendous resource and loved by so many people.
Oh, thank you so much for sharing those insights about the director. So in this coming year, in 2014, what can the public expect, I think, in terms of programs and initiatives?
Yes. Well, of course, we start every year with the legislative session. One of the issues that is most important to us in the environmental programs is to adjust the funding for our programs from the barrel tax. Currently, every barrel of petroleum that's imported into the state is taxed $1.05. 5 cents comes to the Department of Health that supports more than 40 employees and a wide range of our environmental protection programs. And, the good thing is we're importing less oil. That's part of the plan. The bad thing is that means I have less money to do the work that my programs are required to do by law. And by the way, everybody got a pay raise. So costs are going up and the income is coming down. And so we need to adjust that to sustain our environmental programs. That's a really big issue for us. We're still going to be pushing for the 3rd year in a row for electronic waste recycling. The legislature set a goal for 50% of all solid waste should be recycled. And statewide, we're only at about 35%. So recycling all of our TVs and all of our electronics, our computers, our laptops, our cell phones, these are things that have valuable metals that should be reused. They shouldn't just be thrown away. So we're pushing that to strengthen our recycling programs for electronics in this coming year. Another big issue that's been with us for decades and we're trying to get better on is polluted runoff. Every time it rains, we have to put out a brown water announcement, advisory. If it's brown, stay out of the water. Some of that is natural, but a lot of that is man-made pollution. When the rain washes off our streets or off the farms or off of the mountains, it carries with it silt and dirt and chemicals and fertilizers and trash and sediment. And we really, as a state, we've made some progress, but we haven't gone as far nearly as we need to protect our waters, our streams, and our oceans. So that's always an initiative from the Department of Health, and we'll be pushing again this coming year.
Well, thank you so much. I mean, I know all this is very important, very critical in keeping Hawaii, keeping its beauty, and making it, just maintaining the uniqueness of the islands.
Well, in Hawaii especially, the environment is our economy. If we lose the beauty and the pristine nature of our environment, we lose what it means to live in Hawaii. So we're dedicated to that progress.
Great. Thank you so much,
Thank
Gary.
you.
And again, at this point, we're going to take a quick break, and we're going to take a quick look at fond memories of the director. And when we return, we'll be returning with our special guests, Lynn Fallon and Dr. David Sakamoto. Welcome back to our show, Foundations for Healthy Generations, a program for and about public health issues in Hawaii. We have some special guests today, and joining us now is Lynn Fallon, the Deputy Director of Behavioral Health, and Dr. David Sakamoto, Deputy Director of Health Resources. Thank you both for taking the time to be with us today and share your insights.
Thank you for the invitation.
Yeah.
My pleasure.
I'd like to start with Lynn. you are in charge of behavioral health. So just wanted to kind of recap for this past year, what were some of the major highlights for your administration?
The Behavioral Health Administration is made up of 4 divisions: adult mental health, children's mental health, the developmentally disabled, and the alcohol and drug division. And we have been working on a number of initiatives that do improve the integration of behavioral health and primary care, especially for those who have the most serious conditions. We are the safety net for mental health and substance abuse services in the state. And so as part of that, our initiatives have been partnering with the federally qualified health centers, such as Kalihi-Palama, and our community mental health centers, which are administered by the Adult Mental Health Division. Adult mental health consumers who have severe mental health issues die about 25 years before any of us. And much of it is due to their physical condition. So one of our initiatives is Living Well, which brings those 2 kinds of services together. We're also looking at telehealth initiatives through our children division. And we have telehealth centers set up across the state. You know, our services are statewide, and so in every community in our state. We also recently received a federal grant to work with homeless individuals who have substance abuse problems. These are people that live in your community who, because of their substance abuse problems, may not, and because they don't have housing, may be living out in the streets. So we're working with the city and other state agencies on a project that will enable individuals to get housing, number one, and to get all the kinds of services they need so they can live successfully in the housing and hopefully in a safer living environment.
Wow. Well, you know, earlier in the episode, we shared some fond memories about the director. If you may share highlight some of the programs and initiatives, perhaps, where the director had some impact in the administration.
Director Fuddy touched so many lives. She had extensive experience in state government, and her knowledge of the Department of Health and state government was remarkable. And she never forgot, because she came up through the ranks, starting as a social worker in the community, the importance of the employees. And so every opportunity she had, she would go out to talk to our employees at their places of work, and she called them talk story sessions. Just 2 days before her passing, she was out at Hawaii State Hospital, which is, a hospital for individuals who have the most serious mental health conditions, talking to the employees, listening to their concerns, listening to their ideas about ways to make the hospital a safer place. And I think that was remarkable, because that kind of experience and understanding in state government is key to being able to take action and get the job done successfully.
Yeah. Well, thank you so much. It's very nice to hear that the director was always involved with the employees and took to heart their feedback as well. Yeah. So in this coming year for 2014, what are some of the initiatives or actions that we should expect from the administration?
There's so much underway that Director Fuddy started. For the behavioral health area, it's very litigation prone. So we're past what they call the Macon decision, which affected individuals who have developmentally disabilities. We're past the Felix consent decree, which affected children and mental health, and we're past Clark. We're also faced with changes in our healthcare delivery system. So many of her contributions were about how do we learn from the past And then how do we look for opportunities to strengthen the systems in place through new technology, through ways to improve our record systems for patients, through continuing to do outreach into the communities and look for ways to partner with the hospitals around behavioral health in the communities, to look for ways to improve dental services for those that are developmentally disabled. Those are just some of the examples, and I'm very hopeful as a result.
Yeah, I'm sure that Director Fuddy would be very proud about all the work that the department does, and continuing the legacy that she left behind. Yeah.
Yes.
So I'd also like to ask David, what were some of the highlights from this past year for Health Resources Administration?
Let me try to give, though, a feel for what Health Resources Administration is, because it's sometimes confusing. Maybe the easiest way to explain it is you take out environmental health, you take out behavioral health. I have a lot of whatever is left of public health. So I've got chronic disease, family health service, which are the maternal and child health programs. We have the emergency medical system and injury prevention. We have disease outbreak, which is kind of the exciting part of it when there's like a little epidemic and stuff. It's those guys that go in and investigate and take the proper action. And we have the chronic type of infectious disease like tuberculosis and HIV and hepatitis and things like that. We've redone the state's disaster preparedness plan for healthcare. So it's been an exciting 2 years for me, and I'll tell you, I was thankful every day for DeLeonna's presence. I was the new kid on the block. I've had some experience with the Department of Health before, but nothing like this. And without her steadying presence and her experience, it would have been really difficult. So it's been an exciting 2 years, and a lot has happened, as Lynn has said. And I can give you only a thumbnail of all of the good things that my people are doing. One of the obvious ones last year was the nutritional supplement that people, a certain percentage, developed liver damage from it, severe. One person died, others had to be transplanted, serious problems. It's my staff that wound up doing the investigation, figuring out what it was that caused the hepatitis and what are the proper steps. They worked with the CDC and the FDA, and if it weren't such a serious thing, it would have been really exciting to watch just the whole thing unfold in front of my eyes. We've had a lot of other things that were less dramatic but yet very important. Tuberculosis, which has been around forever, my division chief has really been looking at what the data shows, and we're thinking that a lot less testing needs to be done. Certainly some testing is essential. Healthcare workers, food workers, and others, children at a certain age. But we're going to be re-looking at the whole thing, and it's a major change in that area. My injury prevention guys have used their data to identify which intersections are the most dangerous, which is, something that was fairly remarkable. And changes had been made because of that finding. And again, good work of my people to do that. Chronic disease is always with us. We worked hard on child obesity, which is a problem. A lot of things have to be put into place that basically change how we live our lives. And that's going to be a message going forward that the director strongly believed in. And people will be hearing a lot more as we go forward as well. I could go on forever, so maybe
Well,
I should stop there.
Oh, well, of those that have, I guess, of all the different initiatives and projects over the last 2 years, were there any specific ones that you felt the director had a really deep impact in your work with her?
You know, I recently heard the director talking about our home visitation program, and I could see the passion that she was speaking with. It was calm and controlled, but the energy and the passion was there. She created that program. She fought for it when the budget cuts came. And she, I know, has seen the positive benefits in the families that have been touched by this program. And that really was inspiring and so impressing to me. She was our leader and our mentor, and because she's created a lot of this, lived it, and she knew the details, and she knew the important parts that had to be defended. So.
And I think that particular area is, it's as you said, she helped to create it. It was very close to her heart. Before she was the health director, she was the division chief for Family Health Services Division, which falls under the Health Resources Administration as well. Yeah. Thank you for sharing that. So in this coming year for 2014, what are some major projects that the public might be seeing that is under Health Resource Administration?
A lot of what's happening in healthcare as a whole is part of the governor's healthcare transformation initiative, and we have been part of that. We've been full participants, and people are going to hear more and more about what we found in the work groups and what direction things will take. We're finding that our healthcare workforce is a major problem, shortages thereof, and we're going to have to look at developing telemedicine programs along the line of what Lynn was talking about. It probably will deal with more than, say, telepsychiatry. It'll be more broad, but certainly something along those lines for our neighbor islands. And we're going to have to develop models of how our community care networks will be formed. So the care delivery at the fairly lowest levels will have to be impacted by the changes that are coming. We're going to be developing or redeveloping our oral health program. We're one of the few states that doesn't put fluoride into water, and our children do have a problem with tooth decay. And because of the budget cuts in 2008-2009, the program basically was eliminated, and we're going to restart it. And I think that was one thing that the director strongly pushed for, and we're going to continue her lead on that as well.
Well, again, thank you so much, David, for sharing that too. I think everything that between what you shared, what Lynn shared, what Gary shared in today's episode really speaks to the pillars of the department's strategy, for foundations, healthy generations in the future. We have emergency preparedness that's been touched upon, health equity that's been touched upon, quality service, clean and sustainable environment, and then health promotion and disease prevention as well. So I think I take pride in being an employee of the department as well, to hear all these various activities that's happening. So thank you again for sharing all that information and your thoughts and insight.
Thank you.
Thank you for having us.
Yeah. And to the audience, thank you so much for joining us again for this episode of Foundations for Healthy Generations. We look forward to seeing you in this next year, 2014. We hope that you, your family, your community stay healthy, and that we continue to be the healthiest state in the nation. Until next time, we look forward to seeing you. Ahui ho.
Gotta get up. It's a beautiful day. Lucky that we live Hawaii.
24/7, 365.
Swimming in the ocean anytime.